I'm Amy Ronshausen, the Executive Director of Drug Free America Foundation, and it's a pleasure and honor to be a part of this side event to discuss areas of action responding to synthetic drugs. The global synthetic drug problem refers to the proliferation of chemical substances designed to mimic the effects of traditional illicit drugs like opioids. These substances are often created in clandestine labs using synthetic chemicals that can be more potent, unpredictable, and more dangerous than their natural counterparts. According to the Centers of Disease Control and Prevention, an estimated 109,000 overdose deaths occurred in the U.S. in 2022, the most recent data available. Almost 70% of those deaths continued to be linked to fentanyl and other synthetic opioids. One source of illicit fentanyl production is Mexican transnational crime organizations, who are producing increased quantities of fentanyl and illicit fentanyl-containing tablets using increasingly sophisticated clandestine labs and processing methods. This map is from the U.S. Drug Enforcement Administration and shows the global reach of the Mexican transnational crime organizations. Addressing the global synthetic problem requires coordinated efforts across multiple sectors. I'm going to go over a few of them and then some others in more detail. Legislation and regulation. Governments can enact laws to regulate the production, distribution, and sale of synthetic drugs. International cooperation. Countries can work together to share intelligence, coordinate law enforcement efforts, and harmonize regulations to combat the global trade of synthetic drugs. Increased law enforcement efforts can target the production, trafficking, and distribution network of synthetic drugs. And regulating online platforms. Since many synthetic drugs are sold online, regulating internet platforms and e-commerce websites is crucial. Looking at some of the other ways that we can work on this issue, education and awareness. Public education campaigns can raise awareness about the dangers of synthetic drugs, including their unpredictable effects and potential health risks. These campaigns can target both youth and adults and emphasize the importance of making informed decisions and seeking help for substance abuse. Community engagement. Engaging communities in efforts to address the synthetic drug problem can foster collaboration, build trust, and empower local residents to take action. This could involve establishing community coalitions, supporting grassroots initiatives, and involving community leaders in the decision-making process. Treatment and rehabilitation. Accessible and effective treatment programs should be available for individuals struggling with synthetic drug addiction. These include medical detox, counseling programs, behavioral therapy, and support groups to help individuals and their families overcome addiction and maintain long-term recovery. Harm reduction strategies. Harm reduction approaches aim to minimize the negative consequences associated with drug use while at the same time encouraging and connecting individuals to treatment service. This may be increasing access to naloxone, an overdose reversal agent, or providing fentanyl testing strips. As we engage with individuals in these settings, conducting screenings, brief interventions, and referrals to treatment is a vital strategy. Lastly, early intervention programs. Implementing early intervention programs in schools and communities can help identify individuals at risk for substance abuse and provide them with the support and resources they need to make healthy choices. This includes promoting positive youth development, building resilience, and teaching refusal skills to resist peer pressure. As you can see, a multi-pronged, multi-sector approach is needed to address the impacts of synthetic drugs. Thank you for the time you took to be here today and your commitment in working on this issue. Whether it be at the global or local level, your efforts are making a difference.